Hello friends, today we will discuss about how to estimate blood loss in obstetric hemorrhage. Usually the diagnosis of PPH is established by observing the amount of bleeding and patient clinical status. First we'll see the ways to estimate blood loss. The first is visual estimation. This is the most common method which we follow, but this has a inaccurate estimation of 15 to 40% inaccurate estimation. The second tool which we follow is blood loss estimation by weighing the soiled cloths. Cloths or dressings or pads which we use in our labor room. Most commonly we use gauze pad. If it is the size is about 8 to 8 centimeter, if it is little bit soaking, then it is 1 ml. If it is partially soaked, then we will give 2 ml of blood loss. If it is completely soaked, then it is 5 ml. If 10 such gauze pad are soaked, fully soaked gauze pad, it will be around 50 ml of blood loss. The next tool which we use is kidney tray. Of a medium sized kidney tray, if the kidney tray is little bit soaked, we will give 75 ml. If it is half soaked, this is 1/4, 1/3. 1/3 soaked will give us 200 ml of blood loss. Then if the medium sized kidney tray is fully soaked, then it is 300 ml of blood loss. So 2 such medium trays of kidney size tray is equal to 600 ml of blood loss, which we defined as PPH. Then the next is the pad which we use. If the vaginal pad is partially soaked, it is 100 ml. If it is half soaked, will give us 200 ml. If it is fully soaked, then will give us 300 ml. So if we change 6 such vaginal pads, then it is also PPH, and 2 fully soaked vaginal pad is also PPH. So this is the most commonly used picture which we see in our books. This is sanitary towel which is soaked 30 ml and half soaked is 100 ml, and if the patient is on bed and fully soaked, it is given 1000 ml, and the downward spill on the floor, it is 2000 ml, and the full kidney dish big kidney dish comes around 500 ml. So according to which you use in your labor room, we can estimate the blood loss. Then the third is by calibrated plastic closed ended blood collection drape. This looks like this. This is known as brass bead drape. It has a marking of 500 ml. It is usually tied under our buttocks. Then the fourth one is, this is Kelly's pad, which can be sterilized and reused. This is the pad which we stuck under the buttock. Blood will be collected under and we can measure it. This is washable. All these are like using ways to estimate. How to assess the condition of the patient clinically. This clinical signs will be manifested late only. That is when 35 to 40% of blood loss of like circulating blood volume is lost, the clinical signs will manifest. So that's why we commonly use this table, which is 500 ml, 2000 ml of blood loss. We call it as 15% blood loss, and 1000 to 1500 we'll call it as 20 to 25% blood loss, and 1500 to 2000 ml of blood loss we call it as 30 to 35% loss. This is when the signs manifest. In more than 3500 there will be 40 to 45% blood loss, where the patient will be dead. Here, when we lose about 500 to 1000 ml, there is no signs and symptoms. If the loss is between 1000 to 1500, then pulse rate will increase, BP will decrease, and respiratory rate will increase. When a woman loses up to 30 to 35% of blood loss, she'll be very cold, so manifested as cold extremities, decrease in BP, oliguria, and cyanosis. This is the first way. Then the second is by calculating obstetric shock index. Shock index is calculated by heart rate divided by systolic blood pressure. Normal is between 0.5 to 0.7. This is a non-pregnant woman. For a pregnant woman, the normal shock index is 0.9. If the shock index goes above 0.9, we'll call it as hypovolemia. If the shock index is between more than 1.2, then we'll call it as 30% blood loss. Then the third is by rule of 3. Most favorite questions in Viva. Fall in systolic blood pressure by more than or equal to 30 mmHg. Increase in heart rate by 30 beats per minute. The respiratory rate is more than 30 breaths per minute. And if the hematocrit falls by less than 30%, and reduction in urine output less than 30 ml per hour, all these suggest that the woman has lost at least 30% of blood loss. So this is how we will estimate blood loss in patients with obstetric hemorrhage. Thank you.